Most people over 60 are told the same thing when their blood pressure drops and the room spins. Just stand up slower. It sounds sensible. It sounds safe. But here is what almost nobody tells you. Standing up slower alone does not protect your independence because it never asks the one question that actually explains why the pressure fell in the first place. Sudden drops in blood pressure are one of the most common reasons older adults end up dizzy, unsteady, and on the floor. Geriatric clinics see it every single day, and it is often waved away as simple old age. It is not old age. It is a signal, and most of the time it is a fixable one. Today, I am going to walk you through the 5 things a careful doctor checks first when your pressure suddenly falls, counting down to the one that matters most. And I will give you the single insight that a rushed appointment almost never has time to explain. The number 1 item on this list is something almost nobody talks about, and it is the very first thing a good doctor quietly checks. Stay with me until the end, because that one can change how you approach the next 10 years. Here is the problem with the way this usually gets handled. A typical appointment lasts about 12 minutes. In that window, your doctor has to read your chart, listen to your heart, review your medicines, and answer whatever brought you in. There is almost no time left to measure your pressure the one way that actually catches a sudden drop, which is lying down and then standing up. So the reading gets taken once, sitting down, it looks fine, and you get sent home with just stand up slower. The drop that happens the moment you rise, the one that puts you on the floor, never even shows up on the chart. Let me be clear about something before we go further. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. Everything I'm about to describe is standard, well-established, and something you can talk over with your own doctor. And the stakes here are not small. A single fall in your 70s or 80s can be the difference between living in your own home and losing that home for good. This is not really about a number on a cuff. It is about whether you can trust your own legs when you stand up from a chair, a car seat, or the side of the bed at 2 in the morning. So tell me in the comments, how old are you? And does the room ever tip when you first stand up in the morning? Now here is the one mechanism behind almost every sudden blood pressure drop. And please do not skip this section. It is the key to everything that follows. When you stand up, gravity pulls about a coffee cup's worth of blood down into your legs and belly in a single second. Your body is supposed to catch that instantly by tightening your vessels and nudging your heart to beat a little faster, so the pressure up at your brain stays steady. Think of your circulation like the water pressure in a tall house. When you open a tap on the top floor, a good system has a pump and a set of valves that react in a heartbeat, so the water never sputters. As we age, those valves get slower, and that pump gets lazier. The sensors that are supposed to shout, raise the pressure now, they whisper instead. So when you stand, the water sputters at the top floor, which is your brain, and that sputter is the dizziness, the gray vision, the reach for the wall. Hold on to that picture of the sputtering tap. Every single item on this countdown is really just a different way to fix the pump, the valves, or the amount of water in the pipes. If this is already making sense to you, tap the like button so more seniors can find it. That one tap genuinely helps this reach the people who are quietly afraid to stand up too fast. Let us begin the countdown at number 5. Number 5 is your daily fluid volume, and specifically the glass of water you drink before your feet ever hit the floor in the morning. Remember the water in the pipes. Blood pressure depends heavily on how much fluid is actually inside your vessels, and older adults quietly run low on that fluid almost all the time. The thirst signal fades with age, so you simply do not feel how dry you have become. Overnight, you lose even more through your breath and your kidneys, which is why the drop is often worst first thing in the morning. Low fluid is a half-empty tank, and a half-empty tank cannot hold pressure when gravity pulls it downhill. Large clinical trials in older adults have consistently shown that mild, everyday dehydration is one of the most common and most overlooked drivers of low standing pressure. It is also one of the easiest to correct without a single pill. So here is exactly what to do. Aim for roughly 6 to 8 cups of fluid across the day, spread out, not gulped all at once. Keep a full glass of water on your nightstand tonight. Drink the whole thing before you sit up in the morning, then wait 2 full minutes before you stand. Water counts, herbal tea counts, but limit coffee and alcohol, because both pull fluid out of you and make the tank emptier. The common mistake is drinking almost nothing until noon, and then wondering why the mornings feel so shaky. Fix the morning glass first, because that is the window when most falls happen. Now a caution, because more is not always better. If you have heart failure or kidney disease, or you take water pills, do not flood yourself with fluid. Talk to your doctor about the right amount for you, because in those conditions too much water is its own danger. And if drinking more ever brings ankle swelling or breathlessness, stop and call your doctor. Do not push through. Pair this with a pinch of salt in your morning meal, but only if your doctor has told you your sodium is safe to raise. Fluid and salt work together because salt is what helps your body hold that water inside the pipes instead of flushing it away. Water alone runs straight through you. Salt gives it somewhere to stay. And keep number 1 in the back of your mind, because hydration is often the first thing that quietly stops working when a certain everyday medication is draining your tank. But even a perfectly full tank will still sputter if you stand the wrong way. You can do everything right with fluid and still hit the floor because of the way you rise from bed. That is exactly what number 4 fixes, and it is a skill your body used to do automatically and has simply forgotten. Number 4 is the stage stand-up, a slow, deliberate way of rising that gives your circulation the few seconds it needs to catch up. This is not the same as just standing up slower, and I will show you the difference. Go back to the sputtering tap. When you shoot straight up from lying down, you ask the pump and valves to react in under a second, and an older system simply cannot move that fast. The pressure at your brain falls before your body catches it, and that gap is the dizzy spell. But if you rise in stages, you give those slow valves a running start, so they are already tightening before your head reaches the top. You are not fighting gravity. You are giving your body a head start on it. Rehabilitation and falls prevention programs teach this exact sequence, and studies of these programs consistently show fewer dizzy episodes and fewer falls. It costs nothing, and it works within days. Here is the sequence, step by step. When you wake, sit up on the edge of the bed and stay there for a slow count of 30 seconds. While you sit, pump your ankles up and down 20 times like pressing a gas pedal to wake the muscles that push blood back upward. Then place a hand on a fixed support, a nightstand or a wall, and stand, but stay standing still for another count of 15 before you take your first step. The mistake almost everyone makes is starting to walk the instant they are upright, which is the exact moment the pressure is lowest. Give it those 15 seconds, and the wave passes before you move. If 30 seconds on the edge of the bed still leaves you swimmy, sit back down and add another 30. There is no prize for rushing. Never rise in the dark, turn on a light first so you can see your support, and keep one hand on something solid every single time. And if the dizziness ever comes with chest pain, a pounding heart, or slurred speech, this is not simple low pressure. Sit down and get help immediately. Pair the stage stand-up with the morning glass of water from number 5. Drink first, sit for 30, pump the ankles, then rise. Because the full tank and the slow rise protect you in 2 completely different ways. One fills the pipes, the other gives the valves time to close. And this technique matters even more once you understand number 1, because some medications widen that dizzy gap far beyond what any stand-up technique can close on its own. Still, some people do everything right at the bedside, and the trouble is not the stand-up at all. It is the night before. The pressure games your body plays while you sleep can set you up to fall the moment you wake. And number 3 is about fixing the night to protect the morning. Number 3 is raising the head of your bed and the overnight strategy that goes with it. This is the fix almost no one has ever heard of, and for many people it is the single most powerful one on this list, short of the crown. Here is the strange part of aging circulation. When you lie completely flat all night, an older body often reads that as too much pressure and spends the night quietly dumping fluid through the kidneys. By morning, your tank is drained even further, which is why you wake up and the room tips. Picture leaving that top floor tap cracked open all night, so the tank is nearly empty by dawn. Tilting the whole bed just slightly tells your body to stop draining, so you wake with more water still in the pipes. This approach, tilting the head of the bed, is a long-standing recommendation in the medical literature for people with low standing pressure. It is simple, drug-free, and well-studied. Here is how to do it correctly, because the details matter. Raise the head end of the whole bed frame by about 4 to 6 inches, which is roughly 10 to 15 centimeters, using sturdy blocks or bed risers under the top two legs. Do not just stack pillows under your head, because that bends your neck and does nothing for the fluid effect. The whole bed must tilt as one gentle slope. If you take blood pressure medication and your pressure runs high while you are lying down, talk to your doctor before you do this, because the tilt is often used exactly to balance that. Give it 1 to 2 weeks, because your body needs time to reset its overnight habit. Track how the first 60 seconds of your morning feel across those 2 weeks. If you sleep with a partner, make sure the tilt is gentle enough that neither of you slides down the bed. 4 inches is usually plenty. If you have acid reflux, this tilt often helps that too, a small bonus. But if raising the bed brings new leg swelling in the morning or worsens any breathing trouble at night, lower it back down and check with your doctor. And never make this change if you have been told to keep your head flat for a specific medical reason. Pair the tilted bed with that nightstand glass of water. The tilt keeps more fluid in your pipes overnight, and the morning glass tops it back up before you rise. Together, they attack the worst window of your whole day, the first 60 seconds after you open your eyes. But fluid and gravity are only half the story. Even a full, well-positioned tank needs something to actively push the blood back up out of your legs when you are upright and moving. Number 2 is the muscle pump you forgot you had. Number 2 is your calf muscle pump, supported by graduated compression stockings. Your calves are a second heart, and almost nobody uses them on purpose. Put your hand on your own calf right now and give it a squeeze, because that muscle is about to become your ally. When you stand still, blood pools in your legs like water settling to the bottom of a tall tank. Your heart cannot suck it back up on its own against gravity. But every time your calf muscles squeeze, they act like a hand wringing a wet towel, pushing blood up through one-way valves back toward your heart. As we age, those calf muscles weaken and those valves leak, so the towel barely gets wrung. Compression stockings are like an extra firm hand around the leg, squeezing gently all day so less blood ever gets a chance to pool. Graduated compression is a standard, well-established tool in circulation and falls clinics. Trials consistently show it reduces the pooling that drives standing dizziness. Here is the protocol. Before you stand, and any time you have been sitting a while, do 20 calf raises, rising onto your toes and back down, holding a counter for balance. When you must stand still, in a line or at a counter, gently rock up onto your toes 10 times to keep the pump working. For the stockings, ask a pharmacist or doctor about graduated compression in the 15 to 20 millimeters of mercury range to start, which is the mild, over-the-counter strength. Put them on first thing in the morning while you are still lying down, before the leg has a chance to swell, and take them off at night. The mistake is buying loose tube socks, which do nothing. The squeeze must be firmest at the ankle and looser up the leg. If bending down to pull on stockings is hard, a simple stocking tool or a family member makes it safe. Never wrestle them on while balanced on one leg. If you have diabetes or poor circulation in your feet, check with your doctor before wearing compression, because the wrong strength can cause harm. Check your skin each evening for any deep marks or color changes. And if a stocking ever feels numb, cold, or painful, take it off. That is a stop sign, not a toughen up moment. Pair the calf raises with the stage stand-up from number 4. Those 20 ankle pumps on the edge of the bed are the calf pump waking up, and the compression holds that gain all day. Muscle moves the blood, the stocking keeps it from falling back, but here is the truth that ties this whole list together. You can hydrate perfectly, rise slowly, tilt the bed, and squeeze every calf muscle you own, and still get blindsided by sudden drops if the real cause is sitting in your medicine cabinet. That is number 1, and it is the very first thing a careful doctor checks. So here it is, number 1, the thing a good doctor checks before anything else, and the thing most people completely miss. Number one is a full review of your medications and your fluid volume together, because more often than not, the sudden drop is something you are taking, not something you are becoming. Let me explain why this sits at the very top. A huge number of common medications lower blood pressure, and many of them were prescribed for exactly that reason, or for something else entirely. Water pills, also called diuretics, drain fluid straight out of your tank. Blood pressure pills relax your vessels, which is good lying down but can be too much standing up. Certain prostate medications for men, the ones that end in the sound like tamsulosin, deliberately relax vessels and are famous for causing drops. Some antidepressants and some Parkinson's medications do it too. Now picture all of these as taps quietly draining or widening your pipes at the same time. One tap open is fine, but 3 or 4 open together, all swallowed at the same hour of the morning, and the pressure at your brain simply falls out from under you. This is not a fringe idea. Medication-related low blood pressure is one of the most documented and most reversible causes in all of geriatric medicine, and major clinical guidelines tell doctors to review the medication list first. The tragedy is that in a 12-minute visit, that full review is the very thing that gets skipped. So here is exactly what to do, and this is the most important protocol on this list. Tonight, gather every single thing you take, prescription pills, over-the-counter tablets, vitamins, and supplements, and put them in one bag. Write them into one list, with the dose and the exact time of day you take each one. Bring that list, or the bag itself, to your next appointment, and say one sentence. My blood pressure drops when I stand. Can we review whether any of these are contributing? Ask specifically about timing, because sometimes splitting doses across the day, instead of taking them all at 8 in the morning, fixes the problem entirely. Ask whether any dose can be lowered or any drug can be stopped, which doctors call deprescribing. Ask whether a water pill is still needed at the same strength, and here is the rule you must never break. Do not stop, skip, or change the dose of any prescription medication on your own, not for one single day, because stopping some heart and pressure drugs suddenly is genuinely dangerous. Your job is to bring the list and ask the questions. Your doctor's job is to make the change safely, with you. Now, safety, because this is where it matters most. Until you see your doctor, keep taking everything exactly as prescribed, and simply add the safe habits from the rest of this list: the water, the slow rise, the calf pumps. If you also notice the dizziness hits hardest about 30 minutes after a big meal, tell your doctor that too, because eating pulls blood to your stomach and can drop your pressure, and the fix is often smaller, more frequent meals. And here are the red flags that mean stop and get help now, not tomorrow. If a blood pressure drop comes with fainting, chest pain, confusion, slurred speech, or you actually fall, that is an emergency. Call for help immediately. And if you are ever lightheaded together with any sign of bleeding, black stools, or vomiting blood, that is urgent, because a falling pressure can be a warning of blood loss, not just medication. Here is how number one ties the whole list together. The medication review is the master switch, and the other 4 are what protect you while you and your doctor sort it out. Fix the taps at the top, the medications, and suddenly the water, the slow rise, the tilted bed, and the calf pump all start working the way they were always supposed to. That is why this one is the crown. It makes everything else on this list finally hold. And this is the answer to the promise I made at the very beginning. The number one thing almost nobody talks about is that the cure for your dizziness may already be in your kitchen cabinet, waiting for the right conversation. Getting that one review right is not about a single dizzy morning. It is about protecting the next 10 years of standing on your own 2 feet, in your own home, on your own terms. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman kept getting dizzy every morning and twice ended up on the floor of her bathroom. Her family assumed it was simply her age catching up with her. She had quietly started avoiding stairs, stopped going out alone, and was terrified she would soon have to leave her home. When her full picture was finally reviewed, 3 things turned up. She was drinking almost nothing before noon. She took a water pill and a pressure pill together at 7 every morning, and she shot straight up out of bed. With her doctor, the water pill was moved to later in the day. She added a full glass of water before rising and a 30-second sit on the edge of the bed with ankle pumps. Nothing was stopped on her own. Every change went through her doctor. Within 2 weeks, the morning dizziness had faded to almost nothing. Within a month, she was taking the stairs again and walking to the shops on her own. Not one new pill was added to make that happen. The drop was never her age. It was a fixable stack of small things, exactly like the 5 on this list. Balance is not luck. Mobility is not genetics. Independence is trained. So let us make this simple and doable. Here is your checklist, starting tonight, and every step has a number, so nothing is vague. 1. Tonight, put 1 full glass of water on your nightstand. Drink all of it before you sit up tomorrow. Then wait 2 minutes before standing. 2. Tomorrow morning, practice the staged rise. Sit on the edge of the bed for a slow count of 30, pump your ankles 20 times, then stand with a hand on support and wait another 15 seconds before your first step. 3. This week, raise the head of your bed by 4 to 6 inches using sturdy risers under the top legs, and add 20 calf raises holding a counter before you stand from a chair. 4. This week, gather every prescription pill, every over-the-counter tablet, every vitamin and supplement into one bag. Write them all onto a single list, with the dose and the exact time you take each one. 5. At your very next appointment, hand your doctor that list. Ask one clear question. Could any of these be dropping my pressure when I stand, and can we review the timing or the dose together? Before you go, think of someone in your life who has gotten dizzy standing up, or who has already had a fall this year. This video could be the thing that keeps them on their feet and in their own home. Send it to your son, your daughter, or a friend who worries about you. It takes 10 seconds and it genuinely matters. And tell me in the comments which of these 5 you are starting tonight. Your answers decide exactly what I cover next. If this gave you something a rushed appointment never had time to, subscribe to this channel, where the whole mission is handing you the science and the safe protocols your own doctor wishes they had time to explain. That is the only reason this channel exists. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Kenji Vance. Don't forget to subscribe and live longer.